audience. Hello. Have you ever had to call an ambulance before? Emergency medical technicians respond to thousands of calls a day. They respond to everything from a skinned knee to sudden cardiac arrest. Training and proper equipment for EMTs makes all the difference in safety and good patient outcomes in critical situations. Proper equipment is needed to save lives. Equipment can fail. Alex Chingington, project manager at the Center for Patient Safety, says, "Healthcare has seen an influx of new technology and new devices, as well as improvements to current devices. Many of these innovations have improved the quality and safety for the patient and eased the workload for the provider. But as with any tool, these devices may have weak points or may not be implemented into the system as expected," according to ESM1.com. Common factors of device failure are battery or power failure, stressing the device beyond the intended, and improper usage, which leads us to our next point, equipment misuse. There have been cases of delayed care due to the equipment failure. In one case, in 2015, Rachel Button's wife went into cardiac arrest. He performed CPR until EMTs arrived, and Mr. Bunsen told reporters that he heard the EMTs say, "The battery is dead, I need another battery." And they were talking about the defibrillator. So there was a good minute-and-a-half delay in defibrillating his wife because of the failed battery. They were also using an IO device, which is a device that is drilled into the tibia and goes into the bone marrow to deliver medications into the bloodstream fastest. And halfway screwed in with the drill, their drill battery also died. So that was another 2-minute delay in getting the medications into her bloodstream. And although these cannot be proven to be the cause of her death, it could have been a contributing factor. Getting ambulances and personnel to the emergency in a timely manner could be the difference in life and death, especially in cardiac arrest cases. This is a graph of the time cardiac arrest patients have been down from 1 minute to 10 minutes. And their percent survival rate. So at 1 minute, we're up at 80%, and by the time 10 minutes has passed, we're down to under 10% survival rate. So the fast response time greatly improves survival chances. Another commonly misused piece of equipment that can cause injury is a stretcher. Incorrect use of a stretcher to move patients can cause falls and injuries to the patient and the EMT. This can be caused by inattention, overstressing the stretcher, and a lack of training in its use. EMTs not knowing how to use the equipment can cause failure. This is sometimes due to a lack of proper training, which is going to be our second main point. Proper training saves lives. Inadequate training for the situation or equipment can have negative effects on patient outcomes. In 2014, a 5-year-old girl suffered cardiac arrest, and a defibrillating shock that could have most likely saved her life was not administered by the EMT because they were not trained in pediatric cardiac arrest training. Improper training for the situation and equipment is very evident in transporting critical care patients. EMTs transporting critical care patients are sometimes not trained in the equipment the critical care patients required. By definition, critical care patients require the highest level of intensive skill and are at the greatest risk of death and chronic disability, according to the University of Omaha EMS education. The types of equipment that critical care patients require and EMTs are not always trained on include neonatal incubators for premature babies, chest tubes for delivering medications when IVs are not possible, and devices to measure intracranial pressures when brain injuries have occurred. There's also lots of equipment that is needed to keep the EMT themselves safe while they are on the job. This is called personal protective equipment, and this is going to be our third main point. Personal protective equipment keeps EMTs safe. Nicholas Miller on EMS1.com says, EMT providers have a 6 times greater illness and injury rate than the national average and a 30 times higher risk of transportation-related injuries than the national average. He then gave a list of 6 things to keep an EMT safe on the job that are not currently standard in the industry. The first one is eye protection. Eye protection protects from flying particles, sparks, patient assaults, and biohazards. The next one is knee protection. Knee protection protects against hot asphalt, icy roads, and also biohazards. The next one is to closely follow isolation protocols, which protects against communicable diseases. Body armor protects against EMT-directed violence, which is a problem and has been for a while. And seatbelts are the crucial thing in preventing injury from accidents, and they need to be worn at all times. 84% of EMTs in crashes were not wearing their seatbelts because either the seatbelt was too far away from the patient for them to administer care, or they just chose not to wear it. The last personal protective equipment item that he recommended was a helmet. Because helmets can protect EMTs from head injuries and many different kinds of situations. So in conclusion, training and proper equipment for EMTs makes all the difference in safety and good patient outcomes. Equipment failure and improper training are the most common causes of these failures. So what you should do is contact your local government representatives today and tell them that you support training and equipment for EMTs. Thank you.